It often starts with something so simple, a child's sore throat. But what happens when the body's own defense system turns against itself? That's when you get devastating, lifelong heart damage. Today, we're diving into rheumatic heart disease.
So let's just get right to it with a question that honestly sounds a little crazy. Could a simple, everyday sore throat actually lead to heart failure?
The answer is a shocking yes. For millions of people around the world, that's exactly what happens. This is the story of rheumatic heart disease. Okay, so how on earth does that happen, right? How does a throat infection morph into a serious heart condition? Well, it all boils down to a case of mistaken identity. Think of it like a friendly fire incident happening inside our own bodies. It all kicks off with this really deceptive domino effect. So, first domino, you get a strep throat infection. Pretty common, right? Your immune system, doing its job, launches a full-on attack to fight the bacteria. But here's where things go wrong. In some people, the immune system gets confused. It starts seeing parts of your own body, especially your heart valves, that look weirdly similar to the strep bacteria. And because of that confusion, it starts attacking your own tissues. That triggers this big, body-wide inflammatory illness called rheumatic fever.
Yeah, a really good way to picture this is to think of your immune system as an army. Its soldiers are trained to take out invaders. But in this case, the soldiers get their signals crossed. They start attacking their own side, the heart, the joints, the brain, mistaking them for the enemy they were just fighting.
Now, you're probably thinking, wait, does this happen every single time someone gets strep throat? And the answer is no, thankfully. It's actually pretty rare. We're talking only about 1 to 3% of untreated infections go on to trigger this kind of severe overreaction. The problem, though, is that strep throat is so incredibly common that even that tiny percentage adds up to a massive number of people all over the world. So that brings us to rheumatic fever itself. What is it? It's that first big inflammatory attack. It's a temporary but really serious illness that can affect your whole body. And it's the thing that comes right before any permanent heart damage can happen. Okay, so if that's the danger, what are the warning signs? How do you spot this before it's too late? Well, doctors actually have a pretty clever system for just that. They use this handy mnemonic to remember the 5 biggest signs, JONS. So J is for joints. We're talking painful, swollen arthritis that can even jump from one joint to another. The O, well, the O is kind of a visual cheat. It's shaped like a heart, and it stands for carditis, which is just inflammation of the heart. N is for nodules, these little painless lumps you can find under the skin. E is for a very specific kind of skin rash with wavy edges. And finally, S is for something called Sydenham's chorea. And that last one, Sydenham's chorea, is maybe the most unusual symptom of all. It causes these jerky, involuntary, almost dance-like movements, especially in kids. It's a clear sign that the inflammation has reached the brain. And this is a really, really important distinction to get. Rheumatic fever is the attack, the acute temporary illness that happens first. Rheumatic heart disease is the damage left behind, the chronic permanent scarring of the heart valves. So one is the event, the other is the lifelong consequence. Okay, so you've got all these different symptoms. How do doctors actually put the puzzle pieces together and make a diagnosis? Well, they use a very specific checklist. And that checklist is officially called the Jones Criteria. It's been around since the 1940s. It's basically a step-by-step guide for doctors to confirm a case of rheumatic fever with confidence. So here's how it works. The criteria are split into major clues and minor clues. The major clues are those big ones we just talked about, the Jones symptoms. The minor clues are, well, they're less specific, but still really important parts of the puzzle. Things like a fever or just joint pain without the swelling, and certain red flags they can find in lab tests. And the rule for diagnosis is actually pretty straightforward. A doctor needs proof of a recent strep infection, plus either 2 of those major clues or 1 major clue plus 2 of the minor ones. It's a really clear, logical system. All right, now we get to the most important part of this whole thing. Because despite how serious all of this sounds, this is not some unstoppable force. It's a disease we actually know how to beat. And here it is, the key takeaway. This entire chain of events, from a sore throat all the way to a damaged heart, is almost completely preventable. The solution is simple, and it's twofold. First, treatment. If you treat that initial strep throat with a full course of a basic antibiotic like penicillin, you just remove the trigger. The dominoes never even start to fall. And second, prevention. For someone who's already had rheumatic fever, regular, long-term penicillin shots can stop it from ever coming back and causing more damage.
But wait a minute. If the solution is so simple, why is this still a massive problem? Well, the answer isn't really a medical one. It's a social one. Rheumatic heart disease is, at its core, a disease of inequality. It thrives where there's poverty, overcrowding, which lets strep spread like wildfire, and where people just can't get the basic health care they need to treat something as simple as a sore throat.
And if you want to see the real-world impact, just look at the numbers from a country like India. For kids between 5 and 15, as many as 7 out of every 1,000 are affected. I mean, think about that. In a school with 1,000 students, that's like 7 kids in that one school who are facing a totally preventable, lifelong heart condition.
So that leaves us with one final, really powerful question. We have the knowledge, we have the medicine, the solution is so simple. So why do 40 million people, most of them young people in the poorest parts of the world, still suffer from this? That's the real question we should all be thinking about.